Hi, I'm Dr. Scott McCrimmon, and I'm a chiropractor here at Calamese Family Chiropractic. Our channel is devoted towards giving you and your family the most up-to-date health information so that you can live an active, healthy, and pain-free lifestyle. We hope you find this information helpful. If you do like it, please hit the subscribe button so you can get our latest videos. Leave comments, ask questions. We're happy to answer them as best as we can. And there's videos here from all our practitioners. So carpal tunnel syndrome. Let's start by addressing what exactly it is and where that name comes from. So in your hand, base of your hand into your wrist, you have 8 bones called carpal bones, okay? And they make a little groove. So if you look in the palm of your hand, there's a little groove in there, and the carpal bones are at the back. It has a ligament that comes over top. So it makes a tunnel for a nerve, which is called our median nerve, and that nerve goes through the tunnel and then supplies muscles and skin sensation in through the inner side, the thumb side of our hand, so the first 3 fingers and half of the fourth, and just over the top of our fingers. So true carpal tunnel syndrome is where that median nerve is getting pinched in as it goes through that tunnel. And that can be from injury, it can be from arthritic changes, or that ligament over time, if it's had a lot of stress on over the years, can actually get thick. It takes that tunnel and makes it smaller, so that nerve's trying to go through, it kind of gets choked off, and that's going to make it angry. And when it's angry, the most common symptoms are pain, numbness, tingling, or burning. And in bad cases, it actually leads to weakness of the muscles, okay? So if you have true carpal tunnel syndrome, what you're often going to feel are those symptoms I just mentioned, and they will be starting on the middle half of your 4th finger, all the way over, including your thumb, on the palm side of your hand, and maybe just over the tips. If you are getting numbness, tingling, pain on the back of your hand, on your baby finger, up through the forearm, then we're not talking true carpal tunnel, or there's another problem going on at the same time. So in our arm, we have 3 main nerves that supply everything. There's our median nerve, which we just talked about, which is the one that goes through the carpal tunnel, and that's going to supply what we just talked about. We have our ulnar nerve. That comes from our elbow. So that's your funny bone. If you ever hit your funny bone and it makes your finger go tingly, that's your ulnar nerve. It wraps around the elbow and supplies the baby finger and the other half of the 4th finger on both sides. And then you have your radial nerve, which comes down through the forearm. It'll be implicated in things like tennis elbow and other pain and coming down through your forearm. And it supplies exactly what the median nerve does, but on the back side of the hand. Okay, so trying to figure out where your symptoms are, that's your first clue as to whether you have, again, what I like to call affectionately true carpal tunnel or fake carpal tunnel syndrome. Okay, so now that we understand there's 3 different nerves and they supply different parts of our hand, you might be sitting there saying, well, my symptoms are in where that median nerve is or where that true carpal tunnel is. Well, the next thing we need to look at is it truly getting pinched in the carpal tunnel, or is that median nerve getting pinched somewhere else? And to understand that, we need to understand where that median nerve starts, where it ends, and what it travels through. So if I get my spine out here, if we take a look at our spine, you can see these yellow are nerves, and they come out at every level of our spine, and they go to every tissue, organ, and cell in our body. They control everything and how it works and what we feel. The nerves that supply everything down our arm into our hand, they come from the lower part of our neck. So our median nerve, again, our favorite carpal tunnel nerve, it starts at the lower part of our neck. So it's 5 different nerve roots that come together to make one nerve called the median nerve. And it starts the lower part of our neck. It's going to go through these muscles on the side of our neck, so our SCM, our scalenes. It's going to go under your collarbone, on top of your first rib, so it can get pinched in there. We have a muscle here called our pec minor. It runs behind that. Then it's going to go down the inside of our arm, cross at the front of our elbow, go through these muscles in the forearm, travel down, go through the carpal tunnel, and then into our hand. So that nerve can get pinched anywhere along that path. And I explain this to patients as just like a garden hose. So if you think of a garden hose laying across your backyard and there's water coming out of the end, you can step on that garden hose anywhere along the hose, and the output at the end is going to be the same. You're going to see decreased water flow. So whether I step near the faucet, whether I step near the end or somewhere in the middle, wherever I put pressure, that's still going to affect the end of the garden hose where the water's coming out. And it's the same with our nerves. Wherever that pressure is, it can potentially still create symptoms all the way down to the end of the nerve. So we want to look at where can it possibly be pinched. So let's start at the end and work our way back up. So we talked about the true carpal tunnel. If it's getting pinched in there, a couple things that you can check. You can sit there and tap the carpal tunnel like this, and often that will create some of the tingling. Or you can take your hands, push them together like this, or like this, and sometimes that will put a little extra irritation and you may feel that tingling increase. Common spot that we see in our office is in through the forearm. So people will come in with a lot of forearm discomfort, maybe a golfer's elbow type problem, but there are muscles that run across like this, and the median nerve actually runs between those muscles. There's some specific one, pronator teres, etc. But if they're tight, they can start pinching on that nerve and again give those symptoms. So if you've got a lot of tightness and soreness, or you're someone that works with your hands a lot, this is an area that you really want to get looked at, okay? Because that certainly could be. You may find if you take your elbow straight, pull your fingers under and in, you may feel tightness pulling through your forearm, and that may increase some of that tingling as well. As chiropractors, one of the most common things that we see is people with long-standing carpal tunnel problems. They've gone all these tests and done exercises and stretches, and it's still not getting better. Well, as chiropractors, we know the nerves start in the neck, and this area is an area that we find is often forgotten about in carpal tunnel, but could play a really key role, especially if it's not your true fibrotic carpal tunnel, but really that, as I said, that fake carpal tunnel. So, a couple things that you can do to check some of this out. If you have that tingling in your hand, a couple things we have people do is turn their head away, and does that increase anything? If you bring your head to the same side of the tingling, does that take some of that tingling away? If that's happening, then it's a good indication that the problem is up in this area. Another thing we have people do, and this is one of my favorites, if you've got that tingling in your hand or burning or pain right now, and we take our hand and just rest it on your head like this. Let it sit there for 15, 20 seconds, and all of a sudden if you feel that numbness, tingling, pain going away in your hand, that's a really good indication that your neck or this area is the problem. Okay, and then also we can check in here. We often see first ribs are restricted, or our pec minor muscle. You can poke in here. It can be really tender on people. A tightness in there can create some of those same issues as well. But this is an area on chiropractors that, yes, we definitely check all the other stuff out, but we find this area so often forgotten about. And if you can get this addressed, it can really help out a lot of the other symptoms down your arm. Okay, so now we've talked a little bit about where some of the areas of pressure or pinching can come on that nerve. The next step is, well, what do we do about it? So if it is carpal tunnel and it's somewhere down in the lower part of your arm, a lot of stretching in the forearm can be really, really helpful. So that, as I mentioned earlier, one of the biggest ones we do is have people hold their arms straight out, pull your fingers under, and then pull to the inside. That's going to stretch these muscles in through here. It's good for anywhere. If any of that compression is down here, it's a great stretch to open some of that stuff up. I really want to focus up here because, as I said, as chiropractors, this is really what we often see as the problem here. So number one is the muscles in our neck, okay? The SCM, the scalenes, and then in through our shoulder, our pec minor muscles. To stretch those out, really simple. So pec minor is a muscle that runs from here to here. So the way we stretch that out is we get what I call the high five position, okay? We take our arm, we rest it against the edge of a wall or a doorway, and then we step forward with our other foot, give a little turn, and you're gonna feel that stretch through here. Let me demonstrate that for you. Okay, so to stretch that pec muscle out, our pec minor and pec major, the easiest way is to get a doorway or the corner of a wall. What you're gonna do is you're gonna put your arm on the edge of the door. So forearm, elbow, hand on the corner of the wall or corner of the door frame, 90 degrees at the elbow into your shoulder. We step forward with the opposite foot, just lean forward and just give a little turn away from the arm that's on the wall, and you'll feel that nice pull through here. So again, opposite side, you're gonna see 90 degrees. That's my right arm, so I'll step forward with my left, give a little turn towards that left side, and feel a nice pull through here. Some people even put both arms on the door at the same time and just fall into the door. That's gonna give you a nice stretch across your chest. But anything to get us out of this rolled in posture and start to open that up, that's gonna stretch out and take some pressure off the nerves. Now, to stretch some of the muscles closer to, that are right in the neck, right where the nerve roots are starting in our neck, we have our scalenes and our SCM. So our scalenes run down the side of our neck. They come from the first rib and attach along the side of our neck. And that median nerve weaves between the different, three different scalene muscles. So a really easy way to stretch them is we just take our head, we tilt away from the affected side, so bring your ear to the opposite shoulder, and you can put your hand on top of the head and just give a little over pressure there. You should feel a nice stretch through the side there. Okay. Again, if that's making symptoms worse down your arm, obviously ease up on the stretch or talk to your healthcare provider before you push through. As far as our SCM muscle, so that stands for sternocleidomastoid, a nice big funny name for muscle. But if I turn my head, you can see this muscle that sticks out right here. Okay, so it's it's a big muscle in there that you want to stretch. And the easy way to do that is turn your head away from the side that you want to stretch, tilt back, and then just give a little pressure down on your collarbone. And as you look back, you feel that nice pull through here. Again, if this makes you feel unwell or increases pain, makes you dizzy, so obviously certainly don't push through and talk to your healthcare provider. And I want to show you one last exercise, and this is a general exercise for the median nerve that I find helpful just to mobilize the nerve. So nerves don't like to be stretched ever. We know we like to stretch muscles and it feels good, but taking a nerve and stretching it is certainly irritating for the nerve and they really don't enjoy it. But what we can do, because that nerve can get pinched in all these different spots along the arm, and sometimes we don't even know exactly which one is being pinched, we want to try and free up the whole length of the nerve. So instead of stretching it, which is taking two ends and pulling apart, what we'll do is we'll pull on one end, we'll relax the other end, and then pull on this end, we'll relax this end. That's called nerve flossing, okay? Think of taking a piece of dental floss and going between your teeth. So the way you do that with the median nerve is you take your arm out to the side, pull your hand back, and bring your head towards your hand. So what we've done is we've put slack at this end of the nerve, but we're stretching it at this end. And then what I'm gonna do is bring my hand in. As my hand comes in, my head bends to the other side. So now I'm stretching this side, but putting slack in this side. And we just do this, back and forth. Shouldn't be painful or uncomfortable. And we just do this nice and slow. And do about 15, 20 repetitions of that. And that's just gonna take our nerve, slide it back and forth, and help you free up anywhere along the length of the nerve that maybe that is getting pinched or getting irritated. So as you can see there are many different ways to irritate your median nerve. And it often gets straight to the diagnosis of carpal tunnel when it may not be true carpal tunnel. It may be getting pinched somewhere else. It may very well be true carpal tunnel, but it's certainly worthwhile consulting a healthcare practitioner who does a full, thorough exam of it to make sure you know exactly where that problem is coming from. Because oftentimes it is the neck, and if you can get this sorted out, then a lot of these symptoms will start to improve. As always, doing any exercises, consult your healthcare practitioner first to make sure that they're appropriate for you and that you've had a proper assessment, diagnosis, and treatment plan put together for you. And once you have, you can discuss some of these areas with them, and hopefully you can find the root cause of your problems so that pain, numbness, tingling, burning, even weakness can get better. You can get a better night's sleep and function better the next day. Certainly hope you found this helpful. Please explore our channel for different information from all our different providers, and we look forward to seeing you at the next video.